Okay, this is the video competency for ambulating a patient. So the first thing we want to do, like most of our competencies, is we're going to go to the other room and do a medical aseptic hand wash and grab the patient's chart. We also need to gather our equipment for this competency, which in this case is going to be a gait belt and either a quad cane or a patient walker. You'll only have to do one or the other, but I'm going to put both of them in this video for demonstration purposes. Step 2 then says we should identify our patient and apply the gait belt. So I'm going to call my patient back, Erin Woods. Hi, Erin. How are you today? Good, good. I want you to have a seat right here in the chair if you would. Thank you, Erin. Can I get your birthday, please?
April 10th of 2003.
Perfect. Today what the doctor has ordered is for us to go ahead and teach you how to use your new quad cane, okay? So what I'm going to start with is I'm going to get this gait belt to put on you. This is just something to kind of help you learn how to use your walker, okay? So I'm going to put it around your waist here. So what you want to do is put the gait belt on the patient. It should be snug but not tight. The reason for this is what we want to do is be able to hold on to the patient without grabbing an arm or hurting them. So again, it should be kind of snug. We get it a little bit tighter here, but not too tight. Does that feel okay, Erin? Okay. This is kind of long, so I'm just going to kind of tuck this belt, this extra part into the belt, okay? All right, so the first thing I want you to do is to go ahead and stand up for me and just stay right here. Perfect. Now the next thing I need to do is to adjust this cane to the patient's height, correct height for the patient. So you can see on here it's got this button and we can adjust it up or down depending upon the height of the patient. And where the handle should be for the patient should be at the top of the femur. So the top of that hip joint, so kind of in the middle of the hip, if you will. So I'm gonna put this on the patient's right side because that's her strong side. All right, Erin, let's see. Now it looks like this one is set up pretty good for the patient. It is right at the top of her femur. And now I want to give the patient some instruction on exactly what I want her to do. So Erin, what I'd like you to do is you're going to lead with your right side because that's your strong side. So you're going to put the walker forward about 6 inches or so and then bring your right leg to that walker and your left leg is going to follow. I'm going to be right here if you have any problems, okay? Do you have any questions before we start? Okay, so you let me know if you start to feel tired or anything, okay? So now we're going to ambulate the patient slowly forward. All right, Erin, great. You're doing really good. Give your patient feedback. Keep going. Excellent. Let's go ahead and turn around and get you back to your chair. Good. All right, Erin, you can go ahead and have a seat. Okay, so you want to watch for signs of fatigue, check if the patient has any questions. If the patient does start to get tired or starts to fall, we would need to take appropriate action, which might be grabbing a chair for them to sit on, maybe just stopping. It all depends on what kind of symptoms the patient's having. So now normally what I would do is I would go ahead and remove the patient's gait belt and discharge them, but I also want to show you how to fit the patient for a walker. So instead of the cane, we're going to use the walker. All right, Erin, today the doctor wants us to teach you how to use your new walker. That's going to help you with some of the stability since you've been having some dizziness, okay? All right, so the first thing I want you to do is just stand up. Perfect. You okay? All right. So I'm going to put this walker in front of you, and we want to make sure that the handles are at your hips, okay? So again, you're going to fit it the same way. The handle should be at the top of that femur, not the top of the hip, but the top of the hip joint. So right at that femur, and it looks again like this is already adjusted for this patient. The walker also has the same kind of buttons or adjustment as the cane did, so you just have to adjust all four instead of one leg if necessary. So this looks good for this patient. So again, I want to ambulate them slowly forward and then back to the room. All right, Erin, we're going to go ahead and walk a little bit forward. Let me know if you have any problems or if you have any questions. How's that going? Feeling comfortable? Feel a little more stable with that walker? Good. All right, let's go ahead and turn around back to the room. Good, you're doing fantastic. Are you feeling okay? Okay, good. All right, you can go ahead and have a seat back down here. Erin, do you have any questions about using your new walker? Okay, that sounds good. What I'm going to do is move this over. I'm going to take off your gait belt for you, okay? Because you did so great, you don't even need help anymore. So we'll remove this. All right. All right, Aaron, do you have any last minute questions before I let you go? Okay, we're all done then. You can go ahead and take your walker and feel more stable. All right, so the last thing that we need to do since we're done with our patient is we need to document this in the chart. So what I'm gonna do is I'm gonna, in Aaron's chart, document the date, the time, assisted patient on how to use walker or quad cane, whichever assistive device that you're gonna check off with, and then I'm gonna sign it. So it's real simple, straightforward documentation. Date, time, assisted patient on how to use walker or quad cane, and then your signature.